Hello. Hello. Can't hear. In the stream with audio only. I'm supposed to hear myself, right?
Yeah.
Then can you open and see whether you can?
Yes, as anybody can do it. Can
Good evening. So we are waiting for our guest. Shortly, he'll be joining in. Sorry for the delay. Our doctor is attending a call, an emergency call from his hospital. Please bear with us. Thank you. Mm-mm-mm-mm-mm-mm. Hello, doctor. Can you hear me? Can you hear me, doctor?
Hello, ini kan?
Yes. Dengar.
Kata media
Good evening.
setting.
Good evening, viewers. Sorry for the delay and some technical glitches. All right. Our session for today, Busting the Myths of IVF, brought to you by BK9 Resources. BK9 Resources is the most comprehensive consulting company in working with individuals, businesses, industries, universities, schools, government and organization locally as well as internationally, all relating to physical, social, psychological, aesthetic aspects of personal appearance and self-presentation in every way. And Women of Essence series itself aims to bring in individuals from various walks of life to come in and to provide workshop for underprivileged women and at the same time bring in some interesting personalities to share with us multifarious insight of womanhood. So now, before we begin, I would like to kindly request all of you to share this live session with your family and friends with the hope that this topic that we are going to talk about today will benefit to many. So let's dive into our topic for today. IVF. IVF involves removing eggs from a woman's body, fertilizing them in a laboratory with her partner's sperm, and transferring the resulting embryos back into her uterus between 2 to 6 days later. Today, assisted reproductive technologies, ART, are available throughout most of the world, and the practice has gradually developed due to refinement in laboratory technology and clinical practice. As with every technological advancement, controversial medical innovation, there are bound to be myths that develops along the way. So, what are the myths and misconceptions surrounding IVF? Many of these misconceptions are only due to lack of knowledge about this technique. Therefore, we have invited a special guest today who is an infertility specialist, Dr. Ahmad Zarif, obstetrics and gynecology consultant from Metro IVF to clear up some of these common misconceptions and remove the social stigma associated with this procedure. Welcome on board, Dr. Zarif.
Hi, thank you pada Bayanti for bikin so inviting me for this master of IVF and IVF. So what you know about the IVF is the infertile couple. So they are dealing with of infertility nowadays. They are defined if you are fit conceive for 1 year with less than 35 years old, whatever. And then if you believe the person for when it's more than 35 years old. So this is the one for 31 for 6 months, one for 1 year. Why they are defined to overly the human is your overly is very
Sorry,
how
doctor,
many things
your voice is breaking.
you tak dengar aku tak boleh tak
Yeah,
clear ke?
it's not smooth. It's breaking.
Dengar tak ni? Sorry, I.
Yeah, okay, better.
Or the issue is the related with the IVF is one of the treatment for couple introduction of
Sorry, doctor, still can't hear.
kita tak dengar tak ada clear langsung.
Yeah, someone commented also. Can't hear.
Dengar tak?
Yeah, but as you talk, it's not smooth.
Clear. Lagi ni. Suara I tak dengar clear.
Uh, Dengar tapi like break in between. Try again, doctor. Try speaking again.
I hear. No, I like to watch FB live with my TikTok live. Because I want us to do it together. So if TikTok orang dekat, saya ni tak dengar orang itu. So
Yeah.
the issue is first, I want to highlight what the
Your voice is breaking actually.
our voice is very clear.
Yeah.
Sekarang sama juga. Semalam tak ada tu. Dengar tak?
Yeah,
Clear?
perfect. Better.
Oh, I tak dengar you punya suara pula.
Alamak. So while waiting for our guest to come back again, let me introduce some background about Dr. Ahmad ZHARIF, our guest. Dr. Ahmad ZHARIF bin Hussein is an ONG consultant who is currently working in Metro IVF JB. He's also a visiting consultant of KPJ Dato On and Columbia Asia Tebrau. He completed his medical degree at Russian State Medical University, Moscow, in the year 2009. Before he started his training at Hospital Paka Sultana Fatimah Mua. In the year 2012, he was transferred to Hospital Segamat, where his interest grew in obstetric and gynecology. He completed his
Hello, clear.
Yeah, can you hear me?
I'm here. Hey,
Yes, I could hear you.
I can hear you.
All right.
You dengar clear tak? Suara I. Sekarang.
Yes, better.
Better. So related with the fertility. So the definition nowadays they are defined as last time during I hospital during medical officer they define 3 years, they define fertility for 5 years, other 5 years. Nowadays they define the definition fertility is the couple would delay to conceive more than 1 year. So they need to seek the treatment, especially for women with less than 55 years old. But for women is more than 35 years old, they define fertility is more than 6 months married and willing to conceive. That's the definition. Why the definition is different? Because of issue of related with the overall reason. So the myth-busting most of my patients ask me, is it all the couple with the IVF treatment or not? So all the couple fertility with the answer is in the fertility treatment, we have 2 types of treatment. So first is any sexual intercourse with the medication. The second one is insemination. The last one is the most success uh, way is in vitro fertilization, which is IVF lah. This one is
Right.
IVF treatment. But in IVF treatment, if couple is suitable and compulsory recommended thing to do the IVF. So back to basic, which is the female factor. I start with the female factor first. Female factor, so especially to the full ovarism, they absolutely need the
Mm-hmm.
IVF treatment. Second one, the bilateral tubal block. The woman will need the bilateral tubal block. They need the IVF treatment. So the third
Mm-hmm.
one, the woman who have married more than 4 years. So for the in this case, activity with the IVF treatment. The fifth
Mm-hmm.
one, the woman more than 40 years old. So they need the IVF treatment. So this is the condition that we are describing for the women's son. At the same time, for male factor, in the male factor, in the male who are diagnosed azoospermia, they need the IVF treatment. This treatment means excess of sperm at all, no sperm at all. But the seminal fluid, there is no what is sperm at all. The second one is the severe oligospermia, which means the sperm the sperm count is very reducing. This uh, this couple with the IVF treatment for this case. Okay? So
Right.
in this case that the optional, the optional whether they did the IVF or not did the IVF treatment. If the couple will try to gender connection, the couple will try the IUI many times and then fail IUI, and then the
Mm-hmm.
couple will get nothing. So this this couple needs the IVF treatment number one. So astenospermia, what is astenospermia? If the sperm mortality is reducing, means the sperm movement is reducing. This is a condition that most of my patients are doctor all of us need IVF treatment. So my answer like this. The answer is there is a two category. One is number three, which is a compulsory. To get better, you need to do IVF. And then another one is optional. So I need to discuss with the couple. Uh, you are suitable for IVF. You may try IUI or normal conception. So this
Right.
is the condition. Okay?
Yeah, because I feel that most of the patients, they always have this conception where IVF is the only option for all the infertile couples. So, when we talk about infertility, it's a very sensitive issue. So it is difficult to actually how do I put it, going to a doctor and testing it out. Okay, how bad is their infertility? So I guess that is the most common misconception, where the patients have IVF is only for um, couples who are infertile.
Right. I agree with Madam Gayatri. So that the stigma that happens in our society is all infertile couple need the IVF or IVF is only for infertile couple only. But
Right.
my concern is that some of the patients there is a hereditary disease.
Hmm.
So first IVF is one of the treatment of this part of the things which the couple has this current miscarriage. Mean after they exclude all the disease, any disease or any implantation failure, and they still unable to rule out what the cause of this current miscarriage means. Which one miscarriage occurred? They need to the IVF and pre-genetic screening. In the pre-genetic screening, we can see the haploidy. We can see any Down syndrome from the embryo, any fatal or spinal syndrome or Edwards syndrome. This is condition where the miscarriage frequently happen. Okay, so at this moment we can avoid, we can choose the best embryo for implantation. So this another condition, the IVF for treatment. Another condition is the ability of fertility sparing. they have breast cancer. So as
Mhm.
you know, if you start chemotherapy or radiotherapy, your ovarian function is reducing. Means you are more likely towards to the menopause woman. So in this case, you try to preserve your fertility by tissue preservation and biopreservation. Because you, I have a few patients of breast cancer. I want to share you breast cancer.
Mhm.
We try to do IVF to freeze the embryo first, and then after the chemotherapy treatment, almost for 5 years treatment, if you all go to the breast cancer, so we transfer after that. So this is a condition where we try to have the couple that having medical illness to get
Mhm.
conceived. Okay? The another one is the indication of age more than 40 years. For some patients, they are request for gender selection. In Islamic
Mhm.
view, the gender selection doesn't mean we change the sex chromosome. No, we try our method to during the PGS, the genetic screening, we can figure what the gender of the baby embryo. That's this
Mhm.
moment we can discuss with the couple. Okay, so this is the condition that we have the couple, and then sometimes the couple, the husband has issue of testicular cancer. We also have that thing. We do the sponsoring, we do the IVF also have the couple. Then sometimes the couple have treatment of the husband has HIV, the husband of syphilis, any infectious disease. So try to reduce the transmission of infection, IUI or IVF like that in the treatment. Okay. So this is the condition we do the IVF also. Very sensitive issue about fertility actually. Sorry.
All right. Okay. You did mention about age. Okay. So another myth, another common myth is IVF can be done and it's suitable for any age group, which is definitely not, because age is the most important factor, I guess, in the choice of IVF treatment, right, doctor?
Alright, Madam Gaddu, I agree with your statement about the age. So, as study shows that over is increasing success rate of IVF is reducing. Okay,
Decrease, correct.
as it happens. Okay? So the more elder you are, the less success rate of IVF is happen. Okay? So this is the study shows. Why? Because increasing age, there is increasing age, male or female. This not belongs to female at all, male or female, both couple, male or
Mhm.
female factor. So the age is a main factor. So why? There is three conditions why the success rate is reducing. First is related to the quality of your oocyte,
Embryo.
quality of your sperm, means quality of the male and female egg reducing. Okay? So this first
Mhm.
is the quality. The second one is the quantity, means the count, the sperm count, the overall reserve is reducing. Means the eggs,
Correct.
the count is reducing. The third one is response. Response, what means by response? How your body accept the hormone to react to increase the overall stimulation, to increase the oocyte size. That condition happen after, especially for women. Women, the cut-off point, the drop up to 30% at the age of 35 years old. All the key is to quantity, quality, and response is reducing at the age of
Mhm.
35 years old. But in the male factor, don't blame female only the age, but the male is cut off point is at the age of 40 years old. Right? Sometimes people they do allow female only to doctor. No, male also is affected as well. Okay.
Mhm.
In Down syndrome, it means to at the age of more than 55 years old, the risk of Down syndrome is increasing 1 into 200. More than 40 years old, 1 in 40 risk. Means this is increasing by age. Because of why? Because of the quality that
Quality.
this
Yes.
happen. Okay? So the more younger, the high success rate of the IVF pregnancy.
Okay, so in your own experience,
18 years old lah. It doesn't mean less than 18 years old, good quality also. Less than 18 years old, poor quality also actually, because the age is immature. Okay?
uh-huh. So in your experience, the most aged couple that you have successfully had their
I
fertilization.
I have one couple that is of 44 years old. 44 years old, they did IVF. Uh, they did the IVF and then the implantation happened. The baby was positive, but in subsequent at 12 years old, they are miscarried. So my
Oh,
case one is the 46 years old, 44 years old.
okay.
The latest one is ongoing. It's a 46 years old from one of 46 years old. So waiting for embryo transfer. This one, the eldest one is 46 years old. So waiting for embryo transfer now. So the success story for my kid is 42 years old. 42 years old, but miscarriage at 12 years old. This may happen because of 12 feet. Miscarriage happen at 12 feet. It may happen sometimes. This is my success story lah. About 42 years old, ever, but after 13 weeks, they are miscarriage. So it happen. Why? Because of first issue of then I plan because of the issue is first is that case is happen. Why? This is organism is reducing, response is
Mhm.
poor, and quality is grade two embryo day 3. So I transfer and then after 13 weeks pregnancy, they are miscarried. So it may happen actually. My case
But the
is like
couple
this.
were aware of all those
They are aware
warning risk.
because
Yeah.
before I'm starting the IVF treatment, I will explain to the couple the risk and the success rate of her case. So because individualized success rate. So it's not the issue of couple or because it's so for IVF, I need to prepare my patient first to get IVF. How to improve the quality by supplement the lifestyle. This is the condition that I try to manage to improve the quality and response. This is the condition that I need to preparation at least 1 month or 2 months before IVF activity. The lifestyle, about the smoking, about the weight. So this is the issue that I'm highlight to the couple, the stress issue, the sleep style, and then about the food intake. So this is all the conditions I will discuss and detailing to the okay, explain and highlight what the preparation you need to do before IVF to improve the success rate. That's why the woman able to implantation but fail at the 2 weeks pregnancy. It happens. Okay.
But why do actually couple wait for too long? I mean, obviously they want to try naturally, but and I'm pretty sure they have seeked medical advisors and all those things. But why, despite knowing that as they age, the success rate of conception will reduce, knowing all those facts, but still, some couples, they wait uh, quite some time to contemplate into deciding to proceed with IVF.
Alright, good question from Gayatri. Why the delay to decide to do IVF? The first, in the fertility, actually, there is a lot of stress issue actually. First during the marital life, the first how to acceptance who are the call, the stress issue. Is it the husband call or the wife call? This is scenario happen. Okay, how to accept condition. So and then awareness, there's the issue, the awareness. The most, the second second major cause is the cost lah. Cost is the cost. As you know, the cost of IVF is not so not so cheaper. It's expensive also for nowadays, right? So that one is why they delay to conceive. They are trying hope that natural conception may work for them. So they try to hope and hope and hope. That's the issue. The fourth one, what happened is awareness cost, and then the hope, and then the fourth one, they try to do all the traditional first and go to the massage first, everything. And then the fifth one, what they make a delay because of sometimes most of them give up, sometimes give up on the way of the treatment. That may happen also because of every time you fail any treatment of fertility, you will be depressed or stressed at all. That's why make some of couple give up along journey of fertility. Because especially like you try normal also you stress sometimes. I mean you try IUI fail also you are stressed. If you try IVF fail almost most of us stress. In the IVF, lot of stress issue. First is the during before meet the doctor. First stress before meet doctor, you are afraid to know who are fall, husband fall, wife fall. First, second, during the screening for screening, which means during doctor check investigate who are the fall. This is second stress. The third stress during decision of treatment at the IUI, IVF, or normal conception. The fourth one is during ovarian stimulation. During the ovarian stimulation, the stress happen. Why? The couple, I think the woman, the wife especially, they are stressed because of my egg respond or not, my egg respond or not. This is stress happen. So the another stress is during the outside pickup, especially IVF. How many eggs the doctor will pick up? How many eggs? This is the condition happen. Then after OPU, the second stress is how many embryo fertilized. So this is stress issue, the long journey of fertility. That's why infertility is a very sensitive issue for couple.
Correct.
Sometimes
Correct.
among the sibling pun, kita tak boleh randomly share sometimes. You don't know, you not sure who are your friends to share every sebenarnya.
Yes.
Sometimes that happen. Okay? So along the journey tu, a lot of stress issue. Me, I will encounter all the stress to reduce the stress. Okay, so that's why if couple not ready, I delay for preparation. If couple, but along the journey, I need the treatment of supplement, I need treatment of the lifestyle. So during the OPU, I decide I look the woman stress, the face expression, how she walk, look at me, how she cheerful or not. Okay, so this is the method how I look at my person overall. Is it she is stressed or not stressed? Okay, so if she is stressed, I not transfer for fresh transfer. I go to deposit and buy transfer. So this is how I encounter with the stress. So during buy transfer, I will give good rest and then I give the MC more better rest, reduce the stress issue. This is the condition that we are looking to reduce every single step of the treatment to reduce the stress. Because why the stress is affect my quality, affect the hormone imbalance, affect the response of the medication. That happen. Okay? Ada soalan je. Ada kat TikTok saya ni paling sama soalan sebenarnya.
Oh my God.
Saya jawab soalan TikTok ni because of
Boleh,
tengah
boleh.
tengah live dengan StreamYard lah, right? So you all kalau nak join di Facebook live tu dekat BK9 punya Facebook page, I'm live dengan Madam Gayatri about the Mythbuster of IVF. So you all kalau kadang-kadang tak perasan you punya soalan, you all boleh letak soalan dekat BK9 punya BKA9 Facebook page. You boleh tengok Facebook page, I tengah live dengan Madam Gayatri. So kat situ you boleh tanya soalan kat situ. Okay? Kadang-kadang I tak baca soalan you all kat TikTok. Sorry guys.
They can go through YouTube also. It's
Ada
another
YouTube
platform,
lah,
YouTube.
BKNR punya YouTube. Okay. Guys, you all boleh join the BKANAIR YouTube. You boleh Google dekat dia orang punya YouTube. You boleh bagi soalan kat situ. I try to answer the BK9 punya soalan. Okay. Any question? Sorry. Sekarang
Okay.
flu increasing tau. You tahu tak? Flu ni sekarang tengah increasing. I share lah. Pit punya case makin increasing. My friend
Mm.
medication, I call dia kata, Dr. Pit dengan OAG ni kan macam adik-beradik. So, kita orang call tanya, hospital kata kosong lagi banyak ke? Dekat KPJ dan all tu full dengan Pit punya patient saja. You
Mm.
imagine the ubat yang untuk flu tu pun
Mm.
reduce habis. Dah habis dalam stok sebenarnya. Okay, back to the question.
So pertaining to what you have been saying about stress issues and all. So once the woman has like okay this going through this stress, talking about this stress, right? So the initial stage is stressful. The beginning stage after the embryo has been transplanted into the uterus is another part of stress. So the question, I feel that they will always have that in their head. Will I be able to carry this throughout, or will something happen in between? Because mind plays an important role as well. You see, it's like that's why they say you must think positive, you must think positive. So partly because of the stress, the age, and their infertility issues, too many factors actually influencing their thought process. And some women are working women, so they opt for unpaid leave and all that, and they're thinking that they should be on complete bed rest and those kind of things. So I guess it's also part of some misconception too.
Question is the misconception about IVF and stress. Is it?
Yeah, it's like this whole IVF thing is too how to say, traumatic. It's a traumatic experience that they have to
Uh,
go through it until the end of this pregnancy.
it happened to all the women, the couple that tried first IVF actually. After the subsequent IVF, they are trying to adapt with the stress. Actually, they know how to adapt with the stress. That's why the more IVF you do, the increased success rate of the pregnancy. While you know how to manage yourself. Okay? So most of the case is the first IVF, second IVF, they are success. Okay? So it happens to all the couple because of they know how to manage themselves during the IVF. Okay, nak makan apa sekarang ni, tidur macam mana, and then they baca reading. First IVF, alamak, macam mana nak buat apa benda berlaku. That's why they are stressed.
Yeah.
They didn't have any guide. Same goes to macam you are first time pregnant. How I want to carry the baby. I don't know because I don't have any experience. If you have experience and you have read lot, and okay, doctor ni bagi ubat macam ni. Okay, doctor this medication supplement. So first time memang stress tinggi. Second IVF, third IVF, they are trying to get themselves how to cope with the stress. Okay? So first, why they are stressed too much? Because they spend their time, spend their money, spend their hope, spend their emotional with the IVF. Then that's why they are stressed with this. That's why before start IVF pregnancy, I try to advise my patient to do DAS test, DASS DAS test. What is
Okay.
DAS test? The mental health to to detect you whether you are in depression or in the anxiety disorder. I don't want my patient end up with depression, mental depression or anxiety. Before I start, I advise my
Actually,
patient.
we healthcare workers also have that DAS test, right, doctor?
Yes, because that happened.
Yeah.
Because I need to advise my patient to do that as well. Because maybe you can't get conceived because of you are stressed. you can't get conceived because you are in medical preparation. Okay, so it may happen also, right? So that's why I advise my patient, couple to do the last test before because I don't want the complication happen. I don't want the couple end up with the depression. Okay? So that happen. IVF is very stressful condition. I'm agree.
Very traumatic experience.
So traumatic, but not so traumatic like delivery lah. Vagina delivery. Vagina
Okay, and
delivery.
they also think that IVF is painful. You know, the hormone jabs, and of course, some of them they don't really know that they will be sedated when the embryo is being transplanted into the uterus, right? So, could you just elaborate more on that?
Right. Okay. Thank you for that question also about is it the IVF is painful condition? I say during septic cup means how we collect the egg, the woman, the wife, the woman will sedate. We will full sedate, so they will not experience the pain. But after the procedure, they may experience the pain. But the pain uh, still comfortable, manageable. Right? So this is the septic cup. And then during the embryo transfer, some women may experience of vaginismus. Vaginismus means they are afraid any vagina penetration. Okay? So it may contribute to pain, but discomfort consistent during the embryo transfer. Why? We, we use the cascus speculum, the dark speculum like that. So this is still uncomfortable for some women. So that's why not comfortable for some women. So that's why they may feel not comfortable. It's not pain, but it's not comfortable. The word and I can see and it's
Mhm.
not during the embryo transfer, it's not comfortable for some women. If they are unable to bear with the pain during the embryo transfer, we may push a bit them also. So I kira memang cry to the system with the during the embryo transfer. They are very painful during the embryo transfer. We sedate them before during the embryo transfer. Usually, during the embryo transfer, no sedation. Patient, I will tell the patient, okay, the embryo, inside the uterus. So this will explain. So, patient not sedate during the embryo transfer, but fully sedated during the oocyte pickup only.
Mhm. All right. Okay. So another misconception. An IVF baby has an increased risk of birth defects, developmental delay, and low birth weight.
Good question about the misconception about the detail and then about misconception about uh, global developmental delay or autism, some kind of reactive autism. Even though you are trying to normal conception, the risk is almost similar to the normal, almost similar like normal conception. So the
Mhm.
issue is that during the embryo, the best part of IVF, we can determine this rate and then we can do the T-genetic screening to screen this embryo as any quality or not any quality. But the defect that may happen, especially in the diabetic. So there may be happen in the structural defect with the bladder, a big bladder, or the heart problem, the kidney problem. This may happen. But in
Mhm.
general, they are almost same with the normal contraction also, but they slightly increase or
Unlikely.
slightly not increase so much. Okay.
But it's very, like, I guess it's less than 1%.
But the risk is about 1 to 2% only.
Mhm. Okay. So another thing, doctor, this IVF, can it cause multiple births?
Multiple pregnancy.
Yep.
Uh, okay, the answer is yes. Uh, why the risk of multiple pregnancy, especially if the disulfuric twin. Disulfuric twin is a means is the disulfuric twin it means one different apa kembar tidak seiram. We call that kembar tidak seiram lah diabetic twin.
Okay.
CTDA. Especially bila this is up to 30% maksudnya. Which untuk dapat mati tu tak mesti is up to 30%. Why it happen because most of the kids we transfer to embryo. Most of the kids. Nowadays they toward this single embryo transfer nowadays. Right. But
Mm-hmm.
most of the kids we transfer to embryo inside it. Why the risk of multiple pregnancy is more than no natural conception. But it's more than the conception. I also can get multiple pregnancy. But 10%, 20%, but in the ideal, up to 30 to 40% can get the multiple pregnancy.
Mm-hmm. So,
Then kat TikTok,
the
lagi
but
tinggi soalan ni.
the multiple pregnancy. I mean, we can actually request, right? Some
Right.
parents do actually request for twins
Uh,
and
some, some parents, they request for multiple pregnancy because uh, the issue is we, we can't decide. We can
mm.
decide. We can confirm that both embryo
Yeah,
implant.
that was my next question leading to that. So how?
Some of my patients, they request for single embryo transfer. Some
Right.
of my customers, they are request for two embryo transfer maximum and transfer to lah. So nowadays they toward age more than 40 years old, they transfer to the embryo may happen also. Okay, so nowadays they are toward to single embryo transfer actually to reduce the risk of multiple pregnancy. Actually multiple pregnancy ni dia
Mm-hmm.
not easy yang macam orang dapat twin nak jaga semua itu. Dia high risk pregnancy actually sebenarnya.
Yes. Yes.
Difficult. Kita jadi
Yeah.
hacker ni, doktor ni nak jaga dia very difficult. Why? Bila you multiple pregnancy, you are tendency untuk dapat diabetes, dapat hypertension, and then
Correct.
dapat preterm liver, okay, and then you
Yeah.
dapat stabilize, you dapat breach, tentang previa. So all the complications, you dapat hyperemesis means you vomiting a lot, excessive vomiting during the first trimester. That we are afraid. So yang tu yang kita rasa macam alamak, clean. So that's why kalau during the field, we are monitoring them every 2 weekly to
Mm-hmm.
to to prevent the risk of twin to twin transmission syndrome. Okay, that's why
Mm-hmm.
we are afraid. One fetal demise, one the baby die, one baby
Mm-hmm.
risk untuk die to other. Nanti kita risau sangat. That's why we try to reduce the risk of multiple pregnancy. I almost always explain the risk of multiple pregnancy, the risk of multiple pregnancy, because I'm afraid that this happens. Okay, adequate question.
Right. Okay. Talking about complications, there are some people who also think that because I did this, all these myths that I came up with, also through my research as well as I did some survey asking from people. So they also think that throughout the pregnancy they'll have various complications compared to natural conception. Is that true, doctor?
The IVF pregnancy, there is a various complication. I'm agree. The risk of complication of IVF first is the triplet or multiple pregnancy. Start from the ovarian stimulation. One, the risk is the ovarian ovarian hyperstimulation syndrome. This is one the complication that we try to prevent during the ovarian stimulation. Means the eggs a lot. very lot, and they are aggressively increasing in size and they multiple. We are trying to prevent the complication from happen. The first. The second one, the complication that happen is one, the risk of that I mentioned just now is risk multiple pregnancy. One is not the complication that the high risk pregnancy. The third one, risk of miscarriage, risk of preterm labor, risk of placenta previa, mean the placenta location in there at the below. This is all the risk that is a high risk in the IVF pregnancy. That's why most of the IVF patient is a precious pregnancy. We are very taking care and frequent the follow up. So they are risk tendency to get diabetic also. And gestational diabetic. Why? Most of the fertility patient is a polycystic ovarian syndrome, PCOS patient. That's why they are
Basically,
tendency.
the risk,
Basically,
uh, basically the risk is almost the same, right? With normal conception and IVF. Yeah, nothing
almost the
so
same,
special. Yeah,
almost the same, but to highlight that how why we do the frequent follow up, we are trying to prevent the risk also. At the same time, they are precious pregnancy. They are trying to conceive
correct.
long time. That's why we are frequent follow up them. That's why it doesn't mean that the contraction tu tak well. Maksudnya
Because the fetus
maksudnya
is gold.
ya tu pun kita sayang juga. Bukan tak sayang sayang juga. But in the idea macam kita rasa macam risau je kenapa berlaku macam tu. Macam
Yeah.
bila tu buat aja ada darah sikit, alamak apa berlaku darah, kita pun dah rasa macam alamak apa berlaku sebenarnya, kita dah bagi ubat kita berlaku macam ni. Sometimes doktor tu akan jadi macam stress because of why, kenapa why it happen, we try to prevent the complication but it happen sometimes. So it happen lah sebenarnya, itu kita
Some
risau
things are
sangat.
out of control.
Ya, something yang bila patient message doktor, saya ada keluar darah sikit, alamak apa berlaku ni, esok jumpa saya terus boleh tak? Macam tu tak, sampai tak apa berlaku ni sebenarnya. Lepas tu kita risau benda tu happen lah. Kita try to prevent because of to accept the miscarriage for me macam alamak something down. Feel bad. Aku rasa macam alamak stressnya. This stress tu kejap tau. Tapi you kena cope because you ada next patient nak kena jumpa. You kena
Mhm.
motivate yourself. You kena bangun balik because ada next patient untuk tolong give up. So you don't give up at all. Maksudnya kalau you give up, orang lain akan give up, person lain akan give up. Kesian orang. So bila fail IVF, bila miscarriage tu, sometimes bila balik jadi stres, duduk menor, kenapa lah, apa berlaku sebenarnya. But it
Apart
happen lah.
from being ONG specialist, you need to be a counselor as well, a psychologist as well, and you have to look after your own mental health status as well.
Apa dia buat ni, kot duster selalu kot tengok skor berapa.
It's part and parcel. Okay, so one last thing, Doctor. Why a lot of people think that IVF will give 100% success rate? Okay, perhaps maybe they try for the first time, it didn't succeed, and they tried for the subsequent time, perhaps the second time also unsuccessful. But they think that if they continued and doing it somehow or other, IVF will surely give an 100% success rate.
The misconception, the first I want to correct is that IVF is not 100% successful. There is no, I'm not sure, maybe ada kot pakar yang fertility yang kata IVF 100%. But for me, it's in the international line, they up to 45 to 50%, 40 to 50%. The success rate is the average. Okay? So why the subsequent IVF, the more frequent you buat, the risk of the pregnancy rate increasing. Why? Because first, you dah tahu, the doctor yang buat tu dah tahu the baseline, you can respond macam mana, how the quality, and they try to improve in the subsequent IVF. Nanti the next IVF, dia akan buat macam ni, dia akan buat macam ni. So maksudnya dia akan check daripada result kopi, dia tengok daripada rahim macam mana, dia tengok respon ubat macam mana, how they respond ubat live. And then they prepare for supplement, more supplement give, and then lifestyle. And the patient also tahu juga macam mana nak reduce temper, dia akan reduce pada reducing the weight, and then they go to apa tu, manage dia punya lifestyle, balance dia punya lifestyle.
They
So
must have
this,
done their own researches as well
yeah,
before contemplating to IVF.
yeah, this is the next IVF. Why the most of the case the second IVF baru berjaya. Most of the case the third IVF baru berjaya because they know how to encounter, they know how to manage themselves. And the doctor has the guideline, the baseline of IVF previously. Apa yang berlaku dekat dia punya embryo, apa yang berlaku dekat the quality, apa yang berlaku dekat respon, apa yang berlaku dekat implantation. That explain how to improve in the subsequent IVF. Maksudnya, the next IVF, dia nak buat apa, dia nak buat apa. Increase the of IVF lah. So that's why, but it's not 100% all. The idea why not 100%, the issue is implantation. Maksudnya, the period of after during embryo transfer, even though you put the glue of the embryo, even though you give all the high-dose of progesterone, even though you are monitoring, you are able to promise you are able to confirm 100% the implantation happen. So this is beyond human limit, okay, because the implantation is new sometimes. Why the implantation fails sometimes? There is a precondition. First, because of the embryo quality. The second is the endometrium. The one means inside the endometrium, inside the uterus, any abnormality inside the uterus, any endometrial polyp. And then the last one is environmental factor. Means during the embryo transfer, how her lifestyle get back during embryo transfer. Okay, during after the embryo transfer, that explain why the IVF fail. Memanglah orang kata tak rezeki ada sini, but need explanation by time also why it happen. Sampai dan you kata tak ada lagi explanation, this we call unexplained.
Okay, doctor. So we are almost at the end of our talk show today. So let's sum up with our Q&A. Would you like to say a few words regarding our talk today, doctor? Or take home message?
Like take home message, first of all, for women, first, don't afraid to do the fertility screening like me. The fertility screening to see the doctor, to detect the issue that we may have to improve your fertility rate. First, don't afraid that. Jangan takut sangat because of we are trying to help you to improve your success rate of the pregnancy. First. The second one, it doesn't mean you need to Mr. I told decide you untuk buat IVF pregnancy. No. I will choose the best one for your case. Actually, which one the best one? Either you start normal, IUI or IVF pregnancy. The third one, I will try my best to do preparation for IVF pregnancy. This is another issue. And then the last one, there's a no blaming game. Means a wife for husband for. No, this is not blaming game because of both factor is to be considered in the fertility treatment. Means male factor or female factor is including in the treatment because they are considered 30% and then there's another one is 50%. This is the contribution factor, male and female factor. To make a baby, dia kena ada female punya egg and male punya egg. Baru dia dapat baby.
Absolutely. Absolutely.
Dia takkan jadi female jadi baby, dia memang tak jadi lah. Male jadi baby memang tak jadi lah. That's why this is not blaming issue, this is a female and male. So maksudnya female and male dia kena duduk berkualiti, good quality baru dapat baby yang berkualiti. Itu baru dia berjaya, insyaAllah.
That's a very wonderful message, doctor.
Doctor, don't takut. Kadang-kadang you all, actually the last message saya nak beritahu juga, jangan terlalu banyak cerita dengan orang ramai sangat. Sometimes you akan down.
Yeah.
Why I kata contoh kita dengan pihak yang tidak sepatutnya. Contoh yang kawan-kawan dan you boleh share your experience but not too public. Maksudnya terlalu yang random aku dah buat ni. Aku suami aku rosak lah.
Mm.
Aku pergi hingga rendah sangat lah. Jangan, because of I'm afraid the third party tu dia akan bagi saya okay, dia makan ubat ni betul, dia makan itu dari betul, dia makan in the end sampai kat saya itu end sampai kat saya
Yeah,
hati
when you're at a desperate situation, you will look into all the options that comes along the way, you know. So you won't even think the risk factor ke apa, nothing will go into your head. So I just want to try this, try that, try that.
itu yang
They
kita
think that whatever people say is based on their experience. That's why they're sharing it to us. But actually,
itu
they don't even know what they're actually talking about, perhaps.
mungkin dia orang buat kaji, dia orang dah buat treatment and then they share macam ni doktor buat macam ni, kenapa doktor Zahid tak buat macam ni. My answer is your body different, her body.
Everyone's body condition is different.
My study mungkin different dengan ada doktor. Mungkin doktor tu dah keluar yang terbaik. Every doktor teliti doktor dia akan fikir yang terbaik untuk dia punya patient sebenarnya. It doesn't
Of
mean dia
course.
bagi ubat ni dia rasa tak baik. Tak. Dia akan ikut that situation. Tengok situation tu dia rasa okay, this is the best medication. Because we are predict that you will respond with this medication. We just predict based on our knowledge, we just predict that you may conceive with this treatment. You may conceive with this kind of medication. So we just predict to help you how to get conceived. But we not confirm yang okay, you makan ubat ni 100% you confirm pregnant. Tak. But we try to help to improve your success rate of pregnancy. Itu our job lah sebenarnya. Nanti kadang-kadang dia bukannya blaming issue. I tak suka blaming issue dia. Itu sebenarnya
It's very subjective, actually.
dia sebenarnya sebab bukan easy untuk ubah lifestyle lah betulnya. Tiba-tiba you isap rokok banyak kali kan, daripada kecil you isap rokok, ada lain isap rokok, tiba-tiba nak berhenti isap rokok. Memang susah lah, maksudnya memang you akan jadi stress lah. Maksudnya this is the idea, what I kata is not blaming you. How to reduce, how to improve the success in future dia actually.
All right, doctor.
Ada soalan daripada TikTok. Klinik saya kat mana, saya kat Johor Bahru. Ada banyak soalan kat TikTok. Kita tengoklah, kita jawab kat TikTok ni.
Thank you so much, Doctor, for spending your valuable time with us to share your experiences and your knowledge regarding this topic. I truly enjoyed this session, and I've gained a lot of extra knowledges as well. And I'm pretty sure those viewers out there, they would have gained some kind of insight, and some unanswered questions would have been answered through our live session today.
Alright. Okay, thank you for the and for inviting me.
Thank you very much, Doctor.
Thank you guys.
Have a good working day tomorrow.
Thank you for listening.
All right. Bye, Doctor.
Bye. Okay, I jawab soalan daripada TikTok punya question pula lah. Alright, ada satu memang tak ada